Welcome to this Vital Talks Live, leaving no one behind, a digital path toward counting everyone by 2030. My name is Shakuntala Santhavan, Shaks for short. We have timed our event with this year's UN General Assembly and the Summit of the Future. A lot of focus on the Sustainable Development Goals, the central premise of which is to leave no one behind. And so tonight we shall explore a digital path toward counting everyone via CRVS, civil registration and vital statistics. We have a fantastic lineup of speakers for you, starting with VitalStrategies' brand new president and CEO, Dr. Marianne Etiebet. And then we'll hear from Dr. Jennifer Ellis, who is with Bloomberg Philanthropies' Data for Health Initiative. And with that, it is over to you, Marianne. Congratulations on your new role.
Thank you, Shaks, and thank you, everyone. This is literally day 4. So I am so excited to see such a full room and to see so many faces who are interested and passionate and committed about this issue. For those of you who may not know me, I come to VitalStrategies really from a range of different roles, whether it's academia, I've been in nonprofits, public sector, private sector, but in all of those roles, I've really asked myself the question, what can I do and what can I do within this organization to really improve the health of diverse communities around the world? And I'm so glad I've landed at VitalStrategies because that's exactly what the 400 plus team is doing in 80 plus countries. So thank you, VitalStrategies, for welcoming me. It's been a great 4 days. I've also been a member of VitalStrategies board since 2021, and so I've really had the privilege and honor to see what they're doing firsthand. They're truly partnering to improve public health systems, challenge the status quo, and advance policies that we know can reduce the burden of chronic disease and injuries globally. We know, as Shaks has mentioned, that building public health systems, robust systems, are critical for global development. And without equitable public health systems, we cannot advance the human rights or strive to reach any of the UN Sustainable Development Goals by 2030. And the fact leading into UN General Assembly Week that we are actually nowhere near those goals is a big challenge that's going to be facing all of us. But I'm still optimistic. All of you came here today. And one of the ways that we are going to hold ourselves accountable to reaching those goals is to make sure that we are counting everyone. And that's the conversation we have before us today. One of the things that also I love about VitalStrategies is our tagline, reimagining public health. And that imagination is expansive, it's inclusive. We are considering even the people that today remain invisible because we are not recording their births, nor do we understand when they die or why they die. And so I'm just, again, really excited to be part of this team that is really imagining and thinking through what the solutions are for those that are still invisible. Because as we all believe, every life does matter. So today, you're going to hear from a robust, erstwhile group of experts about the civil registration work, and why that is so important. Civil registration unlocks, first of all, it establishes a legal identity, as I've learned this morning, that unlocks a lifetime of rights, benefits, protections, and services. And it really does provide the foundation of the social contract between individuals and their governments. But getting to universal civil registration and vital statistics does depend on digitalization throughout every step of the system, whether it's data collection, data management, analysis, or dissemination. And Our panel will be sharing some of the work that they've been doing to both develop best practices and to think through, how we can accelerate their replication and growth. I also want to take the opportunity to share from all of us at Vital Strategies our heartfelt thanks to Bloomberg Philanthropies for their commitment to this effort and being such wonderful partners for so many years. Our CRVS work is a big part of our partnership around the Data for Health initiative, and just really thank you, Jen, and all of your colleagues at Bloomberg Philanthropies. You are also going to get to hear from Jen, who I've been told is a data guru and a systems thinker, and I'm just so pleased to be able to introduce her. So over to you, Jen.
Thank you so much, Marianne, for that kind introduction. It's a pleasure to meet you, and welcome to Vital Strategies. We're so happy to have you here. It's a real treat to be here tonight to talk about this critical issue and to hear from our panel of esteemed colleagues about all of the work that is being done to strengthen digital health data. At Bloomberg Philanthropies, we remain focused on the startling fact that about 1/4 of births and about 40% of deaths worldwide are still unregistered. And because of these missing data, too many people and too many emerging causes of death remain invisible to policymakers who have the power to address these gaps. But there is growing opportunity to have success here. Numerous global calls for action to this area are helping governments worldwide commit to making progress. And data on deaths, especially causes of death, which have been particularly neglected, are becoming the focus of much of this momentum. For example, the United Nations mandate to record every birth and death in the entire population puts civil registration and vital statistics systems at the very foundation of global development. We heard Marianne mention SDGs. SDG 3 calls for mortality reductions in multiple areas: maternal mortality, non-communicable disease, road safety, HIV, TB. Countries need their own directly measured data to fully track these and to hold themselves accountable for improvements in these areas. Unfortunately, the CRVS systems in many countries around the world are not currently able to produce reliable, timely data to understand these important issues that we're all trying to tackle. And of course, the COVID experience was also revealing. Countries with robust CRVS systems were able to track mortality rates in almost real time and use that data for their responses. But unfortunately, without those systems in place, many countries were left in the dark. Bloomberg Philanthropies launched the Data for Health initiative in 2015 with the goal of partnering with countries to sustainably and efficiently improve data on births, deaths, and causes of death, and support the use of that data to inform policymaking. And just last month, we announced that we are investing an additional $150 million in that initiative, bringing our total commitment to more than $430 million. This truly is a real testament to the progress made by our partner countries who lead this critical work. Since then, the Data for Health initiative has supported partner countries to collect over 12 million birth records and over 16 million new or improved death records for a collective 28 million new or improved records across 31 countries. And we couldn't be more pleased to partner with all of these incredible countries. One focus of our new reinvestment is the digitalization of CRVS systems. Digitalizing, I'm going to trip over that word at one point in the next minute or two, so bear with me. Digitalizing CRVS systems can be transformative, making timely registration of birth and deaths more cost efficient and beneficial for everyone. These digital systems can increase access to benefits for more people, provide governments with timely data on public health priorities, and help build the foundation for a future where no one is left behind and everyone is counted. But digitalizing systems can seem daunting and maybe less than feasible. However, there is such good news here, and we are so excited to hear from our panel tonight to talk so much about that. When we started this work at Bloomberg Philanthropies in 2015, we repeatedly heard how difficult and slow this progress could be and how patient we were going to need to be. We're not patient. And we have been so happy to find over the past 9 or so years that this just hasn't been the case. We have partnered with countries that have CRVS systems at many different capacities, and every one of our 25 partner countries has shown an interest and a need for more resources around digital CRVS systems. And we have seen that success is truly possible using sustainable and feasible approaches that have big short-term impact. For example, our colleagues in Cameroon, there's been a development of a digital system for collecting and reporting CRVS statistics, and it's enabling the daily transfer of data on births and deaths occurring in health facilities. Within 5 years, this system will provide monthly statistics on births and deaths registered with the civil registry by sex, commune, and region. Truly incredible. And in Rwanda, as you'll hear about today, and I had the pleasure of hearing about this morning, we are proud to have been able to support the end-to-end digitalization of the civil registration system, a step that allows the system to reach its full potential for all of society and has helped nearly double the birth registration rates and increase the rates of death registration tenfold. Congratulations. Today, you'll hear from experts who are at the forefront of digitalizing these CRVS systems and can speak to the urgent need for, but also the feasibility of digitalizing these systems. I'd like to thank each of them for their participation in the discussion. I know we will all come away with inspiring examples of how digitalization of CRVS is truly an achievable goal around the world. And of course, thank you to Vital Strategies for organizing today's event.
Thank you, Jennifer. Thank you, Marianne. Before we begin, let me first welcome. Thank you so much for joining us. We have here Her Excellency Paula Ingabire, who is Rwanda's Minister of Information, Communication, Technology, and Innovation. We are delighted that you are able to join us. Welcome. Pardon me while I try not to fall off the chair. So, thank you very much for setting the stage for this important conversation. Our expert panel today includes Ms. Shima Sen-Gupta, who is Director of Child Protection at UNICEF, which is the United Nations Children's Fund, right? And Ms. Josephine Mukesha, who is Director General at Rwanda's National Identification Agency, right? And Dr. Philip Settle is Vice President of Civil Registration and Vital Statistics here at Vital Strategies. Thank you all for being here, for sharing your decades of expertise with us. Shima with women and children, Josephine with technology and people management, right? And Philip working to empower governments to improve health and opportunities for all. A lot more about our very distinguished and accomplished speakers in your program. So we heard Jennifer highlighting those shocking statistics. 1 in 4 births, a quarter of all births, and almost 40% of deaths worldwide do not get registered. Marianne talked a bit about this, and Jennifer as well. Philip, please spell it out for us. Why is it so important to count every birth and death?
Well, as we said many decades ago at this point, to not do so is really a scandal of invisibility. It's a scandal of accountability to those who are born and who live without any official trace in the official record. It's a scandal of invisibility to governments who lack the data and information that comes from collecting health information around vital events such as births and deaths and the causes of those deaths. It's a scandal of invisibility from the vantage point of the individual whose rights may not be protected or respected or honored were they not to have established a legal identity through the mechanism of civil registration. So it is now truly possible to count every human life in terms of births, deaths, and the points in between. We have our esteemed colleagues from UNFPA here with us today who are champions of a life course perspective on civil registration. So we should bear in mind that there are other vital events aside from birth and death that also bear on people's health and well-being. But that said, it is really crucial if we believe in a world where everyone deserves at least some kind of equal playing field, a ticket to ride, that my birth certificate or the birth certificate of someone who's born in another part of the country carry value and opportunity and also information for the use of governments to set policy and planning.
Thank you, Philip. Shima, what does registering a child's birth do for that child?
Well, Philip just said it, right? It is about opening doors. It is about access to services. So the UN Convention on the Rights of the Child guarantees a child's legal identity. A child exists, is counted, is tracked, and is protected. That's what it does. If we don't count them, we don't know they're there. We lose them. We don't know where they are, right? So opening the doors for legal identity means linking them health, basic immunization, vaccination, those services which many of us take for granted, right? Going to school. And then there are the parts which are not so nice. So you have juvenile justice issues, children who come into contact with law, and they are protected because they're children. But if you can't prove you're a child, if you can't prove your age, how are you protected? So this is why it is so important to have that birth registration, to have that birth certificate. And there are also now, more and more in a complex world, you see children and families who are displaced, who move by choice or without choice, and they are lost. They're not counted, if they don't have a birth certificate. But if they do have one, which they can take with them across borders, and that is why it's important to have them digitalized as well.
What happens if a child's birth is not registered? They're open, for one, to a lot more exploitation.
Absolutely. They're invisible, so you don't know if they go missing, if they're trafficked, who has them. So it's almost, imagine, right? We can see each other in this room. We're all sitting here. Imagine there is someone here walking around, sitting, listening. We can't see that person. That's what happens to a child without a birth certificate, without registration, right? You can be lost, kidnapped, trafficked, sold. Who's going to know? There's so much. And the basic services that you miss out every day.
Things that we take for granted.
Absolutely.
Philip, you were telling us about a case in the New York Times, right, about a child in Colombia who wasn't registered at birth.
Yes, and it didn't end well. This was a story covered by the New York Times Magazine in March of last year, I believe, or maybe it was the year before at this point. But it was a very searing story and account of the human face of what the consequences of lack of civil registration can portend for those who are currently invisible and who are really struggling, sometimes on the margins of socioeconomic systems, in remote areas, geographically, in low and middle income countries in particular. It's unfortunately probably not a terribly uncommon story, but it was indeed documented in a very searing and penetrating way by the New York Times to really illustrate the importance of a functioning civil registration system to protect children, but also to provide access to services for as many people as possible, universally is the goal, of course, and also to provide that information to governments for the purposes of gaining insight into population health conditions in their countries.
So we heard Jennifer highlighting what's going on in Rwanda, right? What is the current birth registration rate now?
So today we have registration at 90%, and it has gone down from 56% in 2015.
Sorry, what was
it was
that?
56%. Yeah, so now it's 90%. And death has gone from 31 to 41% now. And the timeliness, we are at 98% for birth and 97% for death. Legally, it's within the 30 days, but because we've moved the registration to the place of event, it's actually done within 3 days.
Of the event happening?
Yes.
Wow. So is this because the Rwandan government has digitalized its CRVS system?
Yes, yes. Before we digitizing is scanning from the paper to but the process is digitalization. So when we digitalized our CRVS system, before we did it, parents had to go after birth. They had to go to the sector office to register the newborn baby, and they will be registered in a paper document. And then when they go seek for document for any government or any benefits, they will need to go back to that sector, get a copy of a document, and then go prove it in another office. Then they will get benefits. But by having now a digitized CRVS system, we register in health facilities. So the mothers, actually, when they're discharged, they already have the unique identifier of the baby, and the baby is registered, and then they can immediately access services. So there's no additional trip for the mother to go and register the newborn babies. And it happens the same for birth. But in Rwanda, we, as UNICEF encourages for all the events, so we've digitalized all the 9 vital events as per our family.
We're going to go into more detail about that. I was reading something by UNHCR, right, the UN Refugee Agency. The birth registration and certification rate in Rwanda for refugee children below the age of 5 stands at 99.5%. Wow. And death registrations are also on the rise, right?
Yes.
In your country, as you pointed out. So we're going to hear more about Rwanda's developments there. Philip, is Rwanda's digital system in sync with your vision of the ideal digitalized CRVS system?
Yeah, I mean, I wouldn't call it my vision, but I would call it a collective vision and an emerging vision of one in which civil registration can play a role that was never even imagined when the principles and recommendations were first issued many decades ago. In the 21st century, technology enables this, along with improved field methods to identify births and deaths in particular as they occur at the community level. The necessary coordination and collaboration among many government partners who have to all play a part, an interdependent part in the CRVS system to make it function. And this critical connection that Josephine mentioned to us about the connection of vital events in the health system where they take place in health facilities, be they birth, be they death, be they the assignment of cause of death. All of that together is in fact consistent with a vision that then places civil registration as a digital on-ramp to a lifetime of services and benefits and protections. In this new age of what is now being called digital public infrastructure, which is a fancy word for interoperability of systems so that social service systems can talk to each other, everything's connected digitally. That's what digital public infrastructure is essentially, is those digital connections. CRVS at the basis of that puts people first and puts people last and puts people at the center of the action all the way through their lives.
How urgent is it that countries follow Rwanda's example and go digital? Can the 2030 agenda be realized without such a system?
Well, I don't know if the agenda can truly be realized in practical terms without such a system. We have SDG, or Sustainable Development Goal 16.9, which is about universal identity provision, including birth registration for all. And there's also a target for death registration embedded in measuring that goal. It is an imperative in the sense that it is only in in this I will take ownership of a view. But in my view, it's a critical path to achieving that SDG is digitalization, because the entire world is moving forward into a fourth industrial revolution of information. And as I think Josephine said earlier, information is the new gold. And having systems that function in real time or near real time to provide both the documentation of the event so the individual benefits directly and immediately, and providing the information that accompanies that event so that governments are well informed of an outbreak of a new disease or the resurgence of an old enemy like malaria. So we know there's a new strain of malaria that's very resistant in Africa to anti-malarial medication. So being able to know your population is another crucial benefit that I think heightens the urgency, as you asked about, of the process of digitalization of CRVS systems. Yes.
Shima, what do you think? How urgent, how critical is it that this happens?
Should have happened yesterday. No, absolutely urgent. Again, because we're talking about the doors that it opens, right? The legal identity. And do you know what? I've worked in countries where people have a lot of difficulties. You know, for the average person, life isn't super easy. And then if you have a system where you're born here and then you walk there, get your certificate from there, have to go back, go to the health center, get another certificate or another identity, and you do all these. And these are, parents who are daily wage earners. Each day, each hour that they're away, that's loss of income. They're not able to take care of their kids. And I've seen this, years ago when we sat with them and tried to understand why they wouldn't register the birth, because they just couldn't afford to. Not because they were paying for it, in many cases they were, but because of all of this. So having a civil registration system which is digitalized and which is linked to the DPI is extremely important. It gives the legal identity. It opens up access to all those services. It is also, because for UNICEF, yes, we work for children, with families, and with the government. It's about enabling. It's also for the government to be, as you just said, it's about how does a government know what they provide for? How much do you plan for? Social protection systems, social safety nets. Who needs that? How much of it? Which family has how many? It is so important and really, really urgent because we have so many people in the current context falling off the track, right? With different complexities in their life. And do you know what? With the climate impact, that's going to get worse because families move. When I was in Iraq, we went to the marshlands and, the population in the marshlands are now living there only 6 months in a year because there's no water during the summer. And so they go with their kids and their buffaloes and everything off somewhere else. Nobody knows how many of them go, how many come back, who belongs there. And for years, those kids did not receive their vaccination, 0 dose. And so we had to clean that up. And how do you do it if you don't have a system that records it, right?
So, can you give us an example of someone, a country that has benefited from such a digital system?
So many. So it's very hard to make a choice. But we have Rwanda here, so I'm going to move to maybe 2 little ones, but Tanzania. I think Tanzania has made huge progress over the years. And they started just like that, right? First, they did it in phases, and I think you will hear about Rwanda as well. One of the things that governments know, and we've also worked with them and brought the evidence, all of us together, I don't mean we, just UNICEF, but all of us who work in this field, is what works. And of course, you don't go about it overnight and say, we're going to digitalize all 9 of those and say, everything's going to work in one day, but you phase it. And Tanzania did just that. one of the things I do want to say also, it's not just about having the system, which is a digital system, but it's also about the policy. It's about the legislation that goes with it, right? How do you legislate for this? What policy do you put? What investments and budgets do you put ahead? And Tanzania is one of those that has really managed to do that. The other thing that they realized is a centralized system does not work. You cannot have everyone coming only to the capital or to a main office somewhere. So they actually delegated that responsibility down to the ward level, right? The lowest level of governance, so that they could actually register the births. And they did the end-to-end digitalization, which meant that you could capture the data on a mobile phone at the lowest level, and it would then get into the central system. But you didn't have to physically come in there. Right? So that has made a huge difference in Tanzania. When you see the progress in 5 or 6 years, they doubled it, and they're doing really well. And I want to put a face to this in another country, if I may. Country close to our region, yours and mine. I was in Indonesia at the beginning of the year, and it was really interesting. We went off to Surabaya, and we went to a little town, right? And went to a primary healthcare center. So a baby had been born 2 days before, and the parents were there, and they were actually getting ready to leave, like just been discharged. And they were having this whole ceremony, the birth certificate being given, and the parents also get a little hamper of what the baby needs in the beginning and all of that. And then, they walk on, it's a one-stop center, to the next desk, get a vaccination card, the next date, and so on and so on. And then we walked across, and they have, so this goes on 0 to 17 years for the child, with all the social safety nets that they have, so whatever services. And then we walked on across the hall, and there were these girls and boys in school uniform. It's like, what are you doing here today? They're 17. So they've come to get their ID now, which was already in the system, but now it gets printed out. You get your ID, and that takes you further on. So it's fantastic to see that, and it's so easy.
Thank you, Shima. How did Rwanda do it? You led the process, didn't you, Josephine, of digitizing Rwanda's CRVS system?
Yes. So we started by conducting an assessment and looking at CRVS, because as you know, there are so many events, and all of them, some were registered in one institution, another, like each ministry had a mandate of some events. So you had some events in the Ministry of Justice, some event happening in health, some in local government. But it's about one single person. So some in one place were done on time. So you get some events for this person, they have their data clean for a few of the events in this department, and when you go to the other one, they do not know that it happened. Yet when they go register the other event, they need the information from the other side, but they still have the old information. This, for example, as simple as a mother going to give birth, but they're married, but the health facility still knows them as single. So the father has to go and confirm that they are legally married. And so they need to bring proof. And those are the additional cost. Yeah. So when we went, we first called everybody on the table, and we discussed, and we saw what are the data that they collect, and by law, what are they mandated to have. And we had to come up with one. If we built one single system, we make sure that everybody's business will continue, will not disrupt, because they still have the mandate. The mandate was never taken away from them, but we have one system that collects information on behalf of everybody, but still serve the interest of everybody. And we could not do it in one day. So we started by birth and death, and then marriage, divorce, and legitimization. Divorce and annulment of marriage. And then we went into the other event. The reason we started with those two is because they are the major ones. Because we need, if you cannot get married if you were not born. Yeah, and then and the other one is now the death was also very important because this data is being used across the ecosystem. You need to flag, otherwise you have a booming system that have ghost people because actually they are dead but they're still alive somehow. So you need to also flag that, and then the marriage unlocks so much, and divorce because they enable, for example, the registration in a health facility for a married, this example that I was giving, a mother who's married, a woman who's married, when she registers her baby in the health facility, the health facility has the mandate to only register birth. They do not officiate marriage. But because they receive the information from the ID system, from the mother's ID, they can know that they're married. The child's birth certificate automatically is populated with the father's name and identity number. So it allows a seamless registration without bringing burden of events that do not happen in one place from the other agencies. So having a single source of truth and trust allowed this integration and the registration.
Can I just because Josephine just spoke about the death registration and talked about birth and death registration, I do want to underline that's super important. Of course, birth registration is important, but having the death registration piece is also extremely important. And what we have seen is, because otherwise you have ghost population, you can't plan and all of that. But what we've also seen is what works is it doesn't have to be so complicated. You can actually simplify the death registration. That doesn't have to be as complicated. Who reports it? So simplification is one of the things that have worked in countries where death registration has picked up. So simplify it, who's going to report. And in remote places, in remote communities, you can delegate that to community health workers, for instance, any frontline worker. When governments have done that, when they've delegated, we actually have seen death registration increasing. And when there's attention paid to it, because often we forget, when there was the Ebola crisis, there was suddenly a whole thing we've got to record it. Then came the pandemic, and then now everybody's beginning to, again, forget why it's important. And finally, the investments, right? Governments, and I think this is a very good example, governments need to invest in that piece as well. And the last bit is a bit of a gender part that I'm going to bring in, because we've also seen in some pockets of countries, men's deaths are registered more than women's deaths are, because it's linked to inheritance and all of that as well. So this is why it's so important to have all that counted. Otherwise, even your inheritance rights are impacted, right?
Back to Rwanda.
Yes.
Thank you for that, Shima. How long did it take Rwanda to do this process? Because Jennifer was talking about being impatient, right? And some countries think it's going to take too long.
Yes. So the birth and death was launched in 2020. Actually, we launched it on August 20th. The CRVS Africa Day. It was just after COVID. We're still within that period. So we've gone from 2020 to 2023. And we've digitized all the 9 events. So we do 2 per year, 3, and then the other 4, we did them 2 to the new year.
And it is linked to a broader digital other cancer statuses.
Yes, it's linked to the identity first, and then it also links to our social registry. So we stream the data to the social registry, and the social registry is the one used for social benefits and also flagging events that require a quick intervention from the social protection perspective.
So we've heard a clear case made to go digital, right? But there are currently over 100 low and middle income countries that don't have fully functioning comprehensive CRVS systems right now. Many have paper-based systems with very low birth and death registration rates. Philip, why is that? How much of this has to do with, say, infrastructure limitations, lack of electricity, for example?
Well, certainly there are rate limiting factors such as connectivity, rate limiting factors related to a stable provision of power. We heard earlier from Josephine that you could actually trace the origins of Rwanda's successful digitalization of CRVS back to the investment in the fiber optics that run across the country to carry the data, that was an important building block. And there aren't those kinds of parallel investments in every country, unfortunately. I think that the obstacles to digitalization are beginning to fall. Previously, there were technological barriers. Those no longer exist. There were the barriers of administrative organization of CRVS systems, which, as we heard, you had to kind of take 3 buses and a train and then go die on the doorstep of the registration office to get your death registered. So that's no longer the case. The vital events can be documented at the place of occurrence, at the time of occurrence, with the family members and the individuals concerned. So that's a constraint that's falling away. And then the overall political will and coordination that has been discussed earlier, because the CRVS system is made up of so many component parts, each of which has its own line ministry to worry about it. The collaboration and coordination that we have seen increasingly through things like the hashtag Counting Everyone campaign, plug for that, that we have seen that kind of government will and coordination really correlate with the rapidity of a digitalization process. Unfortunately, we couldn't be joined tonight by a colleague from Bangladesh who is right at the forefront of this sort of work there. But it's another example of where these virtuous pieces of the puzzle have come together in order to enable the environment for the digitalization to transpire.
Josephine, what prompted the Rwandan government to choose to go down this path?
We, in our strategy for transformation, the NST1, it was moving services, not people. So taking the service closer to the people, and therefore CRVS event among the services that most people need, and they unlock access to other services. So digitizing CRVS was really a priority for our government.
Shima, you were talking about what helps move the process along just now, right? You're talking about people, the staff involved. What's needed? Do you need more training for human resources, more people able to do this job of, and is there also a need to make people, the general public, aware of the importance of CRVS, of the need to register births and deaths?
So it's a combination of things, right? It's a combination because in different countries there are different reasons for not registering. And as we were supposed to have Bangladesh, or someone from Bangladesh here today, but some years ago in Bangladesh, for instance, when we went to communities away from the capital and you asked them, they didn't see any value to registering the birth of a child because it wasn't linked to any services. The only time they needed their birth certificate was to get a passport. And as you know, Bangladesh has a huge labor force outside the country. So then they would scramble and try and get it. But that's a long time for that. We don't have to do it now, right? So one is that if they don't see the value, and that is why linking it to all the other services is so important. To have that one continuum is super important. The other thing that happens is, okay, if you have the link and all of that is personnel. I think we've kind of got better over the years. You've got trained people. You've found there are simplified procedures now. You can take the data on a phone. It gets transmitted. All of that is not so difficult. There's been a lot of delegation that we've seen, like who can register a birth, so that again, it's like what Josephine just said. It's not about people going to services coming to them. You delegate that, a frontline worker, a health worker, if the baby's born at home. So with delegation, that makes it more simplified as well. So we've seen these barriers kind of dropping off gradually. And we've also done a lot of work, again, by we, I mean the whole sector, in creating that awareness, creating that need, having social behavior change programs where you sit with community members and you discuss with them and you try and identify where the gaps are and then try and say, oh, but you can do this. And this links to that card, which will give you your benefit, you get more, you can be part of that food distribution system, all of that. So it's also creating that awareness that has actually helped break some of those barriers. Then, of course, what else is difficult is, I spoke about legislation and policy, and sometimes there is this disconnect where some countries, their legislation or their constitution or their policy may not clarify. And so, again, I will talk about Bangladesh when the Rohingya arrived in millions. The worry was if they registered the birth, they would be giving them citizenship. And so it's also that clarification that needs to happen. So often you have this whole pocket of stateless children because countries' legislation and constitutions are not clear.
I have so many more questions. Very quickly, before we open the floor up to audience questions, Josephine, what were the challenges that Rwanda faced in digitalizing your system, and any big lessons you want to share?
Yes, there were many challenges. The first challenge was removing those silo systems, because there were investments that were put into them, and then to have to remove them and then replace them with another system. That was a major challenge, because at the end of the day, people were used to a certain way of doing things. So it was a journey to achieve that. The other challenge was the fear from those who used to do those registrations to feel that their job are being taken away, to come to explain, because, for example, civil registrars were registering birth and death and all the events, and now birth is being done at the health facilities, and now there's that period of confusion when a person comes to the civil registrar at the sector, like, do they send them back to the health facility? Do they register them there? And what happened to my job tomorrow? Like, does it mean that slowly, like, my importance within the community, am I losing it or get all those habits that were there? Yeah, so just bringing also clarification that even if it's moved there, you still have the responsibility for the completeness, because even today, our law, provides registration in health facility, but the civil registrar at the sector is still mandated by law to ensure that all registration within their confinement have to be done. So they go in the system and they see notifications that are not complete. They have to go back to the health facility and then ask them. They have to be answerable to them to know, why didn't you finish this process? So they still have play their role as civil registrars that need to ensure that it is completely done. So those are some of the challenges that we faced, and we still learn even as we continue with the digitization and journey.
Last question to Minister Ingabire. Are you hopeful, Minister, that one day this digital future that we are heading towards will include everyone?
Thank you. I feel like there were people right behind me who've been raising their hand for quite some time, but maybe I'll make my intervention very short and give them an opportunity. Is it going to be possible to not leave anyone behind? I think the answer is yes. However, it's not going to be magical. First of all, leaving no one behind requires that you know everyone. And I think that's the essence of the conversation that is happening here this evening. But what also we need to know is that there has to be a lot of intentionality in making that possible, but also collaboration is key. For all the examples that we heard this evening, I don't think anyone has done it on their own. Particularly my government has been very, lucky to have so many partners that have been able to walk this journey that we started more than 24 years ago, where we decided to put technology front and center of everything that we were doing as a country. Now, maybe one thing that we haven't come back to is data. Which is very critical, because I think it's not just merely the fact of registering events. It's what are we learning from what we are doing, and how is it informing policy decisions and some of the work that we're doing. There was a question asked earlier around whether what happens when you register the death. Do we know the cause? And I think Josephine has responded to that. But what we also need to understand that it's beyond just one system. We have multiple systems that we use within our healthcare system, including the fact that we are deploying a system that will enable us at one point in time, hopefully in the next 5 years, to ensure that every Rwandan has one single medical record. And that makes it easy to be able to follow up on them. Now, we also need to understand that it's not just about systems. It's the infrastructure, it's the digital literacy that is required. It's also making sure that this data is available and how a policymaker is using it. But it's also having a decision. When Rwanda started 24 years ago, our intention was to make sure we deliver services much more easily to our people. Birth certificates were one form of identifying someone, including the ID systems that we had. But also, we had a simple policy where we said it's 0 trip, 0 paper. We don't want any of our citizens to make any trip to get a government service. And that means that even the only paper form service that we provide is a driver's license and a passport. Everything else comes in e-certificate form. Now, let me come back to the point around data. And I remember when we digitalized all these services, one day we asked ourselves, why is it that every 4 months or so, when I'm required to get another service from government, I have to renew my birth certificate or my someone's death certificate? I don't die twice. Someone doesn't die twice, but you also don't get born twice. And so because we're able to digitalize the entire process, we're able to see how many transactions were happening in terms of how many birth certificates were being applied for, and the fact that a birth certificate was expiring every 3 to 4 months required us to go back and change the policy and laws and say, if the only thing that changes on a birth certificate is its validity, then it makes no sense to even try to apply for it every year. I think the only caveat that we made was the marriage certificate, where we said until we've fully, digitized all the paper records and everything is in one system, we will put in a year or two, where at least if I need to apply for a mortgage, they'll need to check that I'm not divorced and I'm not using someone else's assets as collateral. But it's a journey again, and I think what's always important, back to your question around, is it possible? It won't happen magically. It will require that access to infrastructure is happening across the board. It will require that we are training people, the users of these systems, so that they're not feeling like these systems and the technology. Now we have AI, where everyone is scared that their jobs are going to be taken away. It will also require that there's continuous process improvement as we go along, because the needs of our people consistently change. And today we're very excited about the digital ID system that we're going to build, because what it's also allowing for us to do today is to close on the gaps that we had even with the current ID system. Josephine mentioned earlier, when a child is born, you get a unique identifier, but you don't have an ID. And so with the digital ID, you're going to have an ID from birth. People that are stateless, in the stateless category, are going to be identified, because we want to make sure they have the same they can access the same basic services that any Rwandan across the country is able to access. And so it's these improvements with technology that happen and allow us to also pivot and improve on all these systems that we are building, but with the intention of not just building systems, but doing it in a way that is meaningful for the society. Thank you.
Thank you, Minister Ingabire. I wish I could let everybody ask their questions. Again, you will get a chance to ask the speakers directly during the reception, because we do need to wind up, and we have one more speaker. The minister was talking about data, All right, our last speaker is Mr. Ghislain Irakoze, who is a data value advocate with the Global Partnership for Sustainable Development Data. We know we need everyone on board, including young people who are such a major force for change. Let's get the youth perspective now. Ghislain.
Thanks, Shaq, for amazing introduction. Hello, everyone. I'm Ghislain Irakoze, and like as Shaq mentioned, I'm a data value advocate at Global Sustainable Development Data. I currently live in the UK, where I'm pursuing Masters of Public Policy at the University of Oxford. But I'm originally from Rwanda, and I guess you have heard like amazing stories about Rwanda. I'm lucky. I've lived in a period where the Rwandan government was transitioning from paper-based systems to digital CRVS. So I have amazing stories to share. And I think allow me to reflect the time back when I was enrolling in national exams. So I do remember I had a small error on my birth certificate. So especially on the last name, which we're supposed to change the small letter E. So at that time, the Rwandan government was trying to shift from paper-based system to digital CRVS. So and I do remember how worrisome the situation was. So we had to navigate through different offices to get changed the last name. And I do remember like after the 8 hours waiting in long queues, so in dealing with different complex system, we finally got the certificate. So I do remember we were so exhausted, but we finally made the deadline, the registration deadline, and you got to register for the national exams. So today with platforms like Rainbow, which allow me to brag, it's one of the best CVI system across the continent. Truly, it's one of the best. So I try sometimes when I'm with fellow young Africans, I like to brag about it. Because it's one of really good platform across the continent, which is enabling us to access public services and online, especially like efficiently enabling us to save time and stress. Yes, I'm aware that I'm so fortunate to access such services online. And the majority of Africans are struggling, especially countries which are continue to rely on outdated paper-based systems. So forcing people to endure unnecessary hardship to access public basic services. So as convenient as digital platforms are for those of us who have them, so the digital divide remains vast across the continent. So leaving millions without access to these life-changing benefits. So to bridge this gap, it's essential for governments and NGOs and private sector stakeholders to come together to prioritize digitalization and digitalization of SVRC system across the world. So we don't need a SVRC system, which my uncle will need to hire a couple of translators to get things done. And we don't need a CVR system where my grandmother will need to purchase gigabytes of bundles to reload web pages. So by focusing on human-centered design and inclusivity, we can ensure that digital public services are accessible to everyone, regardless of their socioeconomic status or geographical locations. So this transformation is not just about technology. It's about empowering communities, reducing inequality, and building a future where no one is left behind. So as we strive for this goal, let us remember, true progress is measured not by how far we have come, but how many we are willing to brought along with us in this journey. Thank you so much.
Thank you, Ghislain. Thank you to all our brilliant speakers for your continued commitment to public health. We hope you'll stay, join us outside for a drink, tasty morsels, and a chance to continue the conversation. Thank you. Have an excellent evening.